This brief presentation demonstrates how physicians at leading medical centers have used voxgrams.
The clinician treats a three-dimensional patient, not a two-dimensional image. This is as close to a truthful picture of the pathology that we can right now present to a clinician.
Voxcel's digital holography system uses the data from CT and MR scans to produce truly volumetric medical images.
People talk about using computer reconstructions and shading for depth and all that, but that's all artificial. This is true 3D. It's the only technology we have that's truly 3D.
In essence, these images are three-dimensional X-rays.
What this means is that we can interpret the scans more quickly, more accurately, and more confidently.
The clinical usefulness of these images, called voxgrams, has been established for a broad variety of conditions, especially those disorders which account for a significant share of the CT and MR examinations currently performed.
Just looking at either regular plain X-rays or even a highly detailed CT scan doesn't give you anywhere near the amount of information that the voxgram does.
One of the fastest growing indications for CT and MR scans is the diagnosis of disorders of the blood vessels.
The hologram was quicker to read after a short learning curve and gave a different perspective. These restricted MIP fixed views were not helpful. On the hologram, things become much clearer, and the hologram, in fact, raised the possibility of the origin of the neck of this tumor coming from the anterior inferior cerebellar artery as opposed to the pica or posterior inferior cerebellar artery.
It's not only in the determination that a life-threatening condition exists, however, that voxgrams are important. They also provide vital insights to doctors who plan and perform surgical correction of these disorders.
The ability to see a nerve or a vessel under bone is something wished for by many surgeons. Every surgeon wishes he could see the carotid artery underneath the anterior clinoid prior to touching a drill to that bone. Here, with a transparent view of the bone over the vessel, he can actually appreciate that relationship just as it really is, in a way that he's never been able to do before.
Having determined the nature of the pathology, the surgeon is faced with the challenge of fixing the problem. This requires knowledge of the precise locations of both the disorder and the surrounding tissues.
On just a slice in space that the radiologist has presented me with, I have no idea on that. I mean, I can look at the whole sheet of slices and I know what they are, but at least my brain doesn't integrate them as a whole. With the voxgram, I've got much more information than I have from a pile of CT images.
The human body is a three-dimensional structure, and when performing surgery, it's very important to have an idea of the true depth relationships, what's in front of another structure, what's behind, what's to the right, what's to the left. We find these holograms provide much easier to understand information than traditional two-dimensional flat images, which require a lot of training to fully understand.
The acceptance and widespread utilization of CT and MR are in large measure due to their particular importance in understanding abnormalities of the brain.
The MRI data and the CT scan data and the MR angiogram data that these pictures were generated from, of course, contain all the information that these pictures contain. But this is in real-life size and in 3 dimensions. Measurements that you make on the patient can be directly cross-correlated to measurements you take on the hologram. These are the features that make the hologram a valuable intraoperative surgical tool, something more than just a neuroradiologic diagnostic procedure.
Even when all the details of a brain tumor have been observed and understood, the treatment is often difficult and dangerous. Tools that help the neurosurgeon operate with precision and confidence are extraordinarily valuable.
As increasingly more tumors removed, we can monitor our depth and come back to the hologram, measure the same depth on the hologram and see how close we're getting to the back wall.
Disorders of the spine are common and often debilitating. Problems may result from changes in the bony parts, most easily visualized using CT, or in the soft nervous tissue inside the spinal canal, best seen with MR. These cases account for the largest group of CT and MR studies performed.
And using the fusion technique, we can take the soft tissue information and merge that with the bony information and have a whole idea of what's going on with the spinal cord, as well as the bony anatomy, as well as the soft tissue surrounding the injury.
Dr. Edward Benzel recently was confronted by an operating room dilemma at the University of New Mexico Medical Center. What he saw in the patient during surgery was not what he expected, based on the preoperative analysis of two-dimensional displays.
The X-ray confirmed what we thought was the T7 level, and the gross portrayal of the pathology as viewed from behind or dorsally was at the T5-6 level.
During the case, the Voxgram arrived and instantly clarified the discrepancy between the standard radiologic images and the anatomy seen at surgery.
There was significant disruption of the spinal elements, and two, that this disruption was located at one level higher than the compression fracture itself. I truly believe that the Voxgram helped us improve patient care with this case.
You've seen a few examples of how useful Voxgrams can be in conditions that account for a substantial proportion of today's CT and MR examinations. Additional reports testify to the utility of Voxgrams in many other applications, suggesting their clinical use and importance will continue to grow.
I think this technique is going to significantly improve the skills of every surgeon.
There are anatomical relationships that I thought I understood, but I really don't understand and didn't really appreciate until I saw them in different projections on the hologram.
As a diagnostician, if the hologram came out first and the slices came out after, there are some cases you may never look at the slices.